The treatment available for brain tumor would depend on the type of brain tumor. Most of the time the treatment is surgery, neurosurgery. And neurosurgery aims to remove all of the tumor or as much as can be removed safely. Now remember, decades and decades ago, neurosurgeons were a bit more aggressive in their approach, and they used to take out a lot of mass of the brain to make sure they got rid of all the tumor. But with experience, we found out that that was not doing a lot of good to patients, because when you removed all of the brain tumor, or you tried to remove all of the brain tumor, you ended up with a patient who was paralyzed or lost their speech or bound to a wheelchair. And that's why now the practice is to remove as much of the tumor as you safely can. And also, aggressive surgery in the past did not always translate into a cure. So you removed huge chunks of brain along with the tumor, but you still ended up with the tumor either growing back or a new tumor occurring in the same area or a different area of the brain. So now, once you have the surgery, that is usually not the only treatment, and whatever is left behind is treated either with radiotherapy or with chemotherapy. So we have these three treatments: surgery, radiotherapy, and chemotherapy, which could be used for brain tumors. There are many types of radiotherapy techniques. Nowadays we have very advanced radiotherapy techniques, and you might have heard of gamma knife, and you might have heard of SABR. These are high intensity radiation treatments which are more effective and have less side effects. And the latest on the market is proton beam therapy, which now we have 3 centers in UK which are providing it. And proton beam therapy delivers high doses of radiation to the brain tumor with very little defect and very little side effects to the rest of the normal brain tissue. In future, there are more therapies which are in the pipeline, and as they become available, I would be updating you about them. But the future of brain tumor treatment looks really good, and we are having a lot of good advances with excellent results.